Did you know there are special considerations to make about your voice before you have any surgical procedures? Stay tuned, and today I'll get you up to speed before your next procedure. Hi, I'm Stacy Menton from SingingMamasHomestead.com, where we provide information for singers and professional voice users who want to take better care of their voices on a path to vocal wellness through exploration of whole body wellness. Today I'm going to talk about things to consider and discuss with your surgeon prior to any surgeries. So in January of 2019, I had the first surgery I ever needed that required general anesthesia. General anesthesia requires that the anesthesiologist put a tube between your vocal folds to help you breathe, because your vocal folds sit right at the top of your airway. I was very nervous, and the only reason that I did it was because I really had no choice. January 1st of 2019, I woke up with appendicitis, not knowing it was appendicitis. Went to the hospital. They said, oh, it's probably just kidney stones. Don't worry. They did a CT chest and abdomen, and they discovered that I had acute appendicitis. And acute appendicitis meant surgery, I figured. So the surgical resident came in to see me. It was New Year's Day, so everything was a little bit slow in terms of the surgical procedures being done. And the surgical resident came in and he said, okay, well, there's two options. We can do surgery, which will guarantee that everything gets better, or we can do antibiotics, but there's a 30% fail rate. At first I said, yeah, sure, sign me up. I will take the surgery. I'm gonna have to just deal with this. I'm very nervous about my voice. And I told him I was a singer and a speech pathologist and a voice specialist and how important my voice was, and he understood, but he was pretty adamant that surgery was the best route for me. And then he let me sit in the emergency room and the waiting areas for a very long time because it was New Year's Day and they were waiting for the surgeon to get in because the residents can't do surgery without the attending there. So I waited for a few hours, and while I was waiting, I started Googling things. I don't recommend Googling things now. I was looking for journal articles that were in like medical journals, so they were peer-reviewed articles. And I found some peer-reviewed articles that actually said that there was a 70% success rate, which didn't really equate to me at first when he said 30% fail rate. That means there's a 70% success rate. So I thought, yep, we're gonna do this antibiotics. I've changed my mind, no surgery. We tried the antibiotics. I did them, they pumped me through full of IV antibiotics overnight that night, and nothing was really working. By, somebody woke me up around 2 a.m. saying, hey, this is a risk that you're taking. I said, well, we haven't had enough time yet. Let's give it at least until the morning. And then somebody came in, a female surgeon or female surgical resident came in and said, yeah, if you're not feeling better by 11 in the morning, we should probably consider, we should probably go through with the surgery. And I said, oh, okay. But then I thought about it after she left, and about 20 minutes after she left, I asked them to call her back and said, hey, can you bring her back? I think I want to sign up for surgery now. I'm no better. I'm not worse, but I'm no better. I'm still in just as much pain, and it should be getting better. Since it wasn't, that was the end of that. So I had surgery. I didn't get to talk to the anesthesiologist and the nurse anesthetist until, right before the surgery, but they were pretty reassuring. They said that, this isn't their first rodeo. They've been doing this. I explained my biggest concern being that, I've never been intubated, and that while I recognize that most people who are intubated for surgeries come out fine, I'm a professional voice user on many different fronts, and it's really important that my voice continue to be my voice. And they said, well, okay, we're going to use a size 5 endotracheal tube, which is the smallest that they could use, and we're going to use a glide scope to place it. I was okay with that. They put me out. I woke up. I was doing lip trills in the anesthesia recovery unit. But my voice was working and everything was okay. And I, went back and I was fine. That's the end of the story, was I was fine. But I'm also a voice specialist, speech pathologist who sees patients who have difficulty with their voices after intubation. So I stressed pretty hard to the anesthesia team that I needed my voice, and they made sure to protect it the best that they could. They did everything they could to make it better. So that brings me to what recommendations I would make to talk to your surgeon or any physician really about anesthesia, what the plan is for anesthesia. Number one, you want to tell every single medical professional that you see that you're a singer. Even if you're having surgery on your foot, it's probably going to mean general anesthesia. You want to make sure that the surgeon, the anesthesiology team, your primary care doctor, everybody knows that you're a singer, so that they understand that that's a big piece of your job, is to use your voice. Number two, when surgery is needed, you want to speak with the anesthesia team as soon as possible. Now in my case, they were not going to see me until I was in the surgical area. So I got into the pre-anesthesia area and they said, here's the anesthesia team. And I got to talk to them. It was 5 minutes. It doesn't need to be a long conversation, but you need to stress to them how important your voice is and that you'd like them to use the smallest tube possible, a glide scope if possible, and if they can, there's this thing called a laryngeal mask airway. It's this thing that blows up. It goes into your mouth and it blows up to keep your tongue out of the way, and then the air just goes right down into your throat, into your windpipe, without anything actually touching your vocal folds. So that would be your best bet if it's possible. Now for me, that was not an option because I was having abdominal surgery and it was laparoscopic, which meant they have to blow your belly up with air to be able to get through. So they have to be able to control your breathing. This is number three. If voice changes do occur more than a day or two after surgery, you want to be asking for a laryngology consult right away. Ideally, you will have had a laryngology consult well before any surgeries you've ever had, so that the laryngologist has a baseline of what your vocal folds looked like. And then you get another laryngology consult or just follow up with your laryngologist after surgery if the voice issues that you're having last more than a day or two. It's just really important that you get in there and get seen. It may get better. Nerves can be cut, nicked, stretched. The vocal folds can kind of fall asleep. There's lots of things that can go on that can get better, but you want to make sure that you're being under the care of a laryngologist if you're having voice issues, since you're a professional voice user. And then the only other thing I'd recommend would be to just, in general, continue to maintain good vocal hygiene. If you want to learn about how to care for your voice to keep it in good shape, consider taking my vocal wellness course. I'm going to leave a link for it in the description below. Otherwise, it's been great talking to you today, guys, and I'll look forward to seeing you in the next one.